Let's listen to an expert doctor, Dr. Amitesh Chakraborthy from Fortis Escorts Hospital, New Delhi, for hypertension in young population along with coronary artery disease and higher heart rate. Can be sure of happy heart. Doctor, how do we define hypertension? And when should we conclude that the person has hypertension?
As per the latest guidelines, hypertension is defined as any blood pressure, the systolic being more than 140 and diastolic being more than 90. There are a few other gradings available which grade the hypertension to be mild, moderate, severe. But for the general knowledge, it's considered as more than 140 systolic and more than 90 diastolic. And when you consider a patient who's already been on antihypertensives, the targets change a little. When you consider them on antihypertensive medications, you tend to keep it close to 130 to 139 systolic and 80 to 89 diastolic. Depending upon the comorbidities that you have, when I mean comorbidities, I mean associated diabetes, associated coronary artery disease, associated heart issues, associated kidney issues. It's considered to be well controlled if you are close to 120 systolic to between 120 to 140 and between 80 to 90 millimeters diastolic.
Doctor, what is the relevance of heart rate in hypertension?
So generally we see that when you are anxious, when you are under the influence of any privilege or it might be just a personality. The higher the heart rate, the blood pressure easily, is somehow directly proportional to the heart rate. So heart rate control becomes an important aspect of blood pressure control. As we have seen, there are drugs which act both on blood pressure as well as heart rate. So those drugs are supposed to be better in people who have a tendency to higher heart rates associated with higher blood pressure. But overall, if you think a blood pressure needs to be controlled in a better way, a heart rate control becomes one of the important aspects.
Doctor, what precautions should a patient take along with medication?
One of the more important associations that has been seen over a period of time is salt intake associated with hypertension. So the recommendations are to keep salt, whatever it is, in the food and don't allow raw salt to be consumed if you are a hypertensive. So the general value which is given is 2.4 grams of NaCl or around 4 grams of salt, as we said. So lesser the salt, the better control you can expect from the patient's perspective. When you talk of stress relievers, that might include a change of environment, that might include regular exercises. They all help in control of blood pressure. But when you talk of a person who is a diabetic, now a well-controlled diabetes, when you talk of diabetes, you talk of sugars. So sugars, if they are well controlled, they also help in hypertension. When you have associated kidney problem, better controlled kidney issues, including the regular follow-ups, they also allow you to have a better control of blood pressure and hypertension.
Public Awareness Initiative by Glenmark Pharmaceuticals.